Hello. I moved to the Netherlands 13 years ago. And immediately I was baffled by the Dutch language. Apart from the usual, and then the monkey comes out of the sleeve, and then looking as a cat from a tree, which do sound really strange for a non-Dutch speaker, I was confronted by one phrase in particular. Doe eens normaal. And I couldn't place it. I couldn't understand what were people demanding from me. What is normal? And that has been my quest for actually far too many years. And to save you some time, I would like to share an answer straight away. There is no normal. And it's amazing news. But I know that you will not trust me straight away, so I do need to prove my hypothesis to you. And that is why I'm going to take you on a journey I have been following all these years, a much shorter version, don't worry. So please fasten your seatbelts and prepare for quite a ride. We are starting in the far city of Maastricht, where I was doing my PhD studies in social medicine. Particularly, I was working a lot with child and youth healthcare physicians, Dutch child and youth healthcare physicians. And they showed me an amazing tool. It was called growth curve. That's a very baffling concept, because you want to monitor the babies very, very well, because they're so vulnerable. So when the baby is born, in the first months or years, you're monitoring their height and their weight. And you're placing them on a curve, and you're comparing this curve to all the babies born in the Netherlands, and you assume that if the baby is nicely on the curve, there is no problem. They are, guess what, normal. And then within +2 and -2 standard deviations is still considered to be okay. I immediately thought, that's a very easy quest. I have my answer straight away. So what we need to do is we simply need to measure things, put them on an X and Y axis, then compare them to the whole world population, and we have our normal. Can you guess the roadblock I hit? What on earth do you measure? Because I only had X and Y's axis, and there were hundreds and hundreds of things I wanted to measure. Moreover, a lot of things I wanted to measure turned out to be not measurable at all. It is impossible to put a number to a vast variety of these variables. Okay, my first attempt was a flop, but I didn't give up. After my master's, after my PhD, I decided to follow with a master's in neuropsychology. I know the order doesn't make sense, it's a bit timey-wimey. But my master's was in neuropsychology. What is neuropsychology about? It is about trying to find diagnostic entities, trying to define different mental health disorders. For me, immediately there was like this light bulb. You know, there is a very old saying sometimes you cannot see light without darkness. It made sense. Maybe I do not know what normal is because I first need to define the abnormal. We need to look into this diagnosis in order to understand what normal is not. I got thrilled. Straight away, running to the bookstore, buying Diagnostic Statistical Manual, downloading the International Classification of Diseases, really diving into all of those categories and subcategories, trying to understand what disorders exist in the world. I think you guess how this talk is going. It was not a total success. Why? I discovered one very interesting thing. Disorders are not very well defined. So many of the criteria are so fuzzy and blurry and are the same. It's very hard to distinguish between them. Moreover, what I found very problematic on a personal side, one of the most common criteria in the Diagnostic Statistical Manual is that a person needs to have a disorder for at least 6 months. What do you mean 6 months? What if I have it 5.5? Or 5, or 4? Does it mean I do not deserve help? Does it mean that there is nothing wrong in my life that deserves attention? This became even more problematic when I started my clinical internship at the child psychology practice. In that practice, what I have seen time after time happening is that children were brought to our practice. And they were in a very difficult life situation. The most common ones, bullying at school, stuck in between a very messy divorce, moving to a new location with no friends, some traumatic experiences and abuse. Moreover, these 4 categories were not mutually exclusive. Yet, these were the children who were brought to my office, and the parents asked me, please fix her. Something is wrong. She's not reacting how we want her to do. She's experiencing difficulties. Work with the child. And I couldn't understand why, because the situation, the external factors, were giving her pain. And I was not able to influence those external factors at all. So I got really disillusioned in the psychological perspective. I thought, okay, it was a very nice attempt, but it means that I cannot define light with darkness. I need to move on. And the third perspective and the third lens, which I picked up in my postdoctoral studies, actually was the closest one I got to the answer from the books. I picked up a cultural, socio-cultural perspective. My hypothesis was, normal actually is not you. Normal depends on the society and the community you are living in. This hypothesis became almost a conviction upon reading an amazing book, Crazy Like Us, where the author is giving a lot of answers, a lot of examples and answers to what is normal and abnormal and what is mental health and how it is seen in different cultures in the world. One example which stuck with me so much was the example of Sri Lanka. At some point, Sri Lanka was hit by the most disastrous tsunami possible. And this case is very famous in the field of global mental health because this was the first ever recognized global mental health humanitarian crisis. So of course, if there is a crisis, what do people do? They all want to help. They fly in. So a lot of therapists, psychiatrists, psychologists flew to Sri Lanka. And in psychology, there is one metaphor which is very, very commonly used, and I think you may have heard it, which was used a lot in the Sri Lanka crisis. This metaphor was, during the flight attendant is giving these wonderful instructions that far too few people listen to, and among the instructions is one thing. In case of emergency, if the masks appear from the ceiling, please secure your own mask before helping people around you. This is a very much used metaphor. You need to make sure that you are okay before you help people around you. And this metaphor was used a lot in Sri Lanka. And it didn't work very well. Because for the people there, helping self and helping others were indistinguishable. Actually, they were helping themselves by helping others. So the Western ideas of self-help and treating the traumatic experience were not as successful in that humanitarian crisis. So this lens, despite the fact being very, very close, also didn't give me a very good answer to things. And actually, none of these lenses did because of two things: space and time. I will explain them both very, very shortly. What do I mean by space? When we're talking about the concept of space within normality, I do need to give one heartbreakingly unfortunate example that I use in my lectures. It is homosexuality. Being completely normal in some cultures, societies, and groups. It is still seen as a crime that is worth punishing in the others. Moreover, in third, it changes completely and it becomes a disorder that needs to be treated. You see how the same concept changes throughout space. In order to give an example of time, I basically need to say two words. March 2020. This was the time when all of us, more or less overnight, appeared in a completely different reality. We moved from big parties and festivals and fun to social isolation. From hugs and 3 kisses when we meet each other to 1.5 meter distance. We moved from seeing our smiles and communicating with our mimics to face masks that are covering half of our face. And that has been hard. I've seen it in all people surrounding me. And I want to have a word of caution. Right now, so many of us are happy with the vaccination rates. And how are they going? I need to caution you. The shock of going to pre-pandemic is going to be comparably big for majority of us to March 2020. It will not be easy and we should not take it for granted. But back to my quest. As I showed you, hopefully, neither of the 3 lenses, the biomedical, psychological, or sociocultural alone gave me an answer about normality, what is normal. Books were not helping. What helped? Surprisingly, or actually for me not at all, these were young people I'm working with. For the past 10 years, actually more than 10 years, I have been working in a variety of universities, working with talented young people on both bachelor's and master's level. And so often, for one or another reason, young people ended up in my office. They were facing some difficulties and they were searching for advice everywhere. They looked on the internet, they read books, they asked family and friends, some of them even asked help of health professionals. And all these quests left them disillusioned, betrayed, and guilty. How come? They were telling me, this advice that I got worked for everybody else around me. It seems that my problem was fixable, but I failed. Is my case so hopeless? Am I so inherently broken? Of course, what I wanted to do in this situation, because of my heartache, was to scream in their faces, "Nothing is wrong with you." Unfortunately, I was not able to do it because it's not a very good advice. So the advice I gave to them, become a sponge. Try to get all the advice possible from all the direction possible. Try to channel it through you. Try it out. Don't be afraid that it will fail at this exact moment. Learn yourself. Learn and understand what works and doesn't. Create your personalized solution. Actually, what I wanted to say is, keep listening to the wind of change. Channel it through you, be open to it, and let it help you grow by always remaining yourself. Thank you.